starting our second full month now of the COVID-19 virus. Just to recap this week, going back to Saturday, April 25th, there was one new case of COVID-19 that brought our total to 30. Sunday, there was one more additional case as well. On Monday, there were no new cases. Tuesday, there was one new case to report, and the total number of tests received was over 800. Wednesday, we had one new case that brought our total to 33. And yesterday, we announced that the additional 3 cases of COVID-19, bringing our total to 36. Today, we would like to announce we have no new cases of COVID-19. This leaves our county total at 36 confirmed cases, and numbers as follows. We have 7 active cases, 26 recovered cases, 3 fatalities, 47 are under quarantine or isolation orders and are being monitored. And to date, we have had 869 tests returned to Chautauqua County as negative for the COVID-19 virus. Just a little bit, as we discussed, those 7 active cases are right now in our 1st battalion, as last we checked. The remaining 3 battalions did not have any active cases in them. So just wanted to point that out. Yesterday, we did announce the plans for a drive-through COVID-19 testing clinic next Tuesday, Thursday, and Saturday. The COVID-19 team and I decided that this was prudent to conduct testing at this time, as the testing supplies have become more available, and we have had enough on hand to collect a larger sample of tests. At this time, the drive-up testing is only available for essential healthcare workers, first responders, including law enforcement, fire, EMTs, CPS, corrections officer, and child care center workers. Our public health director will comment more on this in just a little bit. Today, I'd like to also remind everybody that while social distancing measures are effective at slowing the spread of COVID-19, they can be very difficult to deal with. And that means for everybody, not only our adults, but also our children. The longer we stay on pause, cabin fever and feelings of loneliness and frustration will increase. And I feel it's important to remind everyone that we're in this together. And I'd encourage everyone to take a little extra effort when dealing with others, but also take some extra time to reach out and connect with others, whether it be your family, friends, old schoolmates, or neighbors. While text or phone calls are great, you can't convey the same message or emotion as when you're connecting face-to-face with somebody. I'm becoming a big fan of video chats, as we both are on several video Zoom meetings throughout the day. For example, my old college roommates and I recently reconnected and have a weekly video chat. One is in Long Island, the other one in the Albany area. So it's interesting that we connect with 3 different parts of New York State and listen to how things are going. My family also connects regularly with other family members. One of the things we picked up are scavenger hunts throughout the house. And I'd like to say my niece really is a big fan of those. But it just brings the family together, and you can have a little bit of fun connecting, even though we're not in the same room as they are. So I'd just like to remind everybody, take a little extra time and reach out to your family. Zoom does have free video meetings and chat. So if you go to zoom.com, not that I'm plugging any one media over the other, but it is a great way to connect with family and friends. If you and others have a group or an iPhone or an iPad, you can use FaceTime. Calling someone using FaceTime in the FaceTime app or from your contact list. You can also initiate a FaceTime group call from inside an existing group text. Zoom, again, we've talked about, is very popular for work meetings. Individuals can use that, and it's a free call up to 40 minutes. You can download the app or visit their website, create an account, and then send the meeting link to your friends. Skype has been around for a long time. It's still a great option to video chat with somebody, but you both must have a Skype account. And calling it, and also last, I became aware that there's a video chat feature in Facebook Messenger. All you have to do is open Messenger app, open the chat thread you want, and click on the camera icon in the upper right-hand corner. That works out great for both individual or group calls. So I'd just like everybody to take a few extra minutes to reach out to somebody. We have had an initiative through NISAC, and that is a Take 5 initiative, and you'll hear more about that. But just take 5 minutes at this time, as we're into this process for several weeks now, to reach out to somebody. So at this time, I'd like to turn it over to Christine Schuyler, our Public Health Director.
Thank you, County Executive Wendell. Good afternoon, everyone. As the County Executive said, we are going to be having our first drive-through testing clinics, and those will be next week. in conjunction with our County Department of Emergency Services. We are doing these clinics at this time because we do have the supplies finally to do them, and also targeting our healthcare workers, first responders, and childcare providers, in particular because this week we did receive updated guidance from the New York State Department of Health on who really we should be prioritizing to be testing. And those groups, symptomatic or not, are now included in who should be tested. There is some controversy over whether or not someone who doesn't have any symptoms of COVID-19 should be tested. But because we know that there's a large portion of the population who could be infected with COVID-19 and be asymptomatic, we feel it important to at least to get a snapshot in time of those who are in direct contact with the public, especially our vulnerable populations, such as the elderly and those who are immunocompromised. This could help us hopefully to prevent any sort of an outbreak that could occur in one of our healthcare facilities, such as a hospital, group home, or a nursing home in particular. So we are asking that anyone who's in those categories that would like to be tested for COVID-19, please call our health department number, 753-4491, or toll free at 1-866-604-6789 to pre-register. You must pre-register for an appointment in order to participate in one of the testing sites. More information can also be found at our website. There will be a sliding fee schedule, which will hopefully go down to zero. I'm still waiting for some update on the State Health Department on exactly how we'll work that, but we will be asking you to bring your insurance card with you as well, and you can get more information if you call to make an appointment. I'm hoping that this community service will help us to really find out if there are some asymptomatic first responders and healthcare workers out there that we can then isolate and help to stop the spread of any COVID-19 that could be here.
All right. Thank you. At this time, we will open up the calls for questions from our media. So we'll start right at the top. From the Dunkirk Observer, Mr. DiAgostino.
Hi, good afternoon. As always, we talk a lot about the situation that's going on in Erie County, and that seems to be top of mind with the state senator, the state assemblyman, and U.S. Rep. Tom Reed. It looks like we're going to be grouped with Erie County in terms of the reopening. Any thoughts on this going forward, or are you going to work with officials to try and get us not to be grouped with Erie County?
Well, I was on a conversation, actually I was on a phone call last night with County Executive Polenkars, and he shares that sentiment that he realizes that we are not like Erie County and understands the situation. Yes, I've been in support of Assemblyman Goodell's, Senator Borrello's, and their regional approach. I do believe that we need to, look at things. Particularly, we are not like Erie County. Our numbers are not the same. So as we move forward, if we can be differentiated from Erie County, that would be a good idea for Chautauqua County. Having said that, there was some optimism in that regard because Erie County's numbers are high, and Chautauqua County was allowed to have elective surgery. So again, a little bit of optimism that they're looking at things as a county-wide basis, so not necessarily all of Western New York would be denied the elective procedure surgery, or schedule rather. So that does bring some optimism. But yes, I support us, being sort of outside of the realm with Erie County. But until that changes, we'll see how it goes.
All right, thank you very much.
Yep. Okay, moving on. WDOE, Dave Rowley.
Well, good afternoon. I understand Pennsylvania, Governor Wolf today announcing 24 counties will be reopening, including both Erie and Warren County, Pennsylvania. What kind of pressure does that put on Chautauqua County, and could that possibly be some influence in Governor Cuomo's decision?
Well, this is the first time I've heard of that. I apologize. Thank you, Dave, for giving us that information. I would like to think that that might influence the decision, but as the governor has said, he's very been staunch on his opinion as to a regional approach, not county by county. I will tell you there was a phone call last night with NISAC officials. There is a lot of sentiment that we do need to be looked at as a county by county basis. Some of these regions, even the regions themselves, need a little bit better representation. That does pose a problem to us, as one of the problems or the discussions will be, if we open Chautauqua County and not Erie County, what influx of Erie County residents will we have on Chautauqua County? Well, the same could be said that if you open Warren and Erie County, Pennsylvania, what influx of New York residents and Chautauqua County residents will you have on those two counties? So, yes, that's a concern as we move forward, because there will be people not moving, but they will be leaving the area to potentially travel or visit restaurants. But keep in mind that there is still a sentiment that many people do not want to travel, do not want to go to those large gathering places. So it'll be interesting to see how that plays out as we move forward. But as far as pressuring the governor, I don't know if those counties will pressure the governor to make a decision, but I think that does add to the uniqueness of Chautauqua County, and we do really stand alone from Erie County and the Western region that we're grouped with.
Another question is on antibody testing, and are we seeing more antibody testing now in Chautauqua County? I know the past couple of weeks we haven't seen an increase. I guess maybe last week we started seeing it. Are we seeing it more now, and could that help perhaps improve some of the statistics about Chautauqua County?
Hi, Dave. It's Christine Schuyler here. We are seeing some more antibody testing being done in the county, and that's because of the Well Now Urgent Care Center in Dunkirk offering that service. It really is not widely available yet at any other facilities or labs in our area. I know UPMC, including our UPMC Chautauqua, is working on being able to have that capability. A lot of the antibody tests that are out there I have not been validated by the FDA and are having some questionable results. And I support our local hospitals and labs who say they want to make sure that they have a very reputable test before they're going to move forward with having that themselves. I do think as we get more antibody tests, it gives us a better picture of I guess when we look at herd immunity and whether or not the virus had been here or people had been exposed to it at some place or time in the past. But having said that, we can probably assume that there is some sort of immunity for those who have been exposed that show up as having the IgG antibodies. But at the same time, there is no guarantee of how long that immunity is for or what it really means yet. There's just so much research that still needs to be done. I can tell you that we are getting some of the results. I am not confident that we're getting all of the results. But I think there was probably a stack of about 90 papers came through today that were all negative for antibody results, and I've only seen one positive of a county resident come through so far. So I'm not real confident we're getting everything yet, though. So hopefully Well Now in Dunkirk, and if that does spread into, if they start doing that testing as well as the COVID-19 testing, in our Jamestown location, I'm hoping that they will increase communication with us about who they are testing and ensuring that we get the negative and positive results.
Hey, Chris. Go ahead.
Sure. Yes, Dave.
Yeah, I just wanted to thank you both for your answers.
Dave, just to piggyback on that a little bit, one of the things after talking with County Executive Poloncarz is one of the continuing questions I will ask the state is, can we get the antibody testing here in Chautauqua County? We, again, with our relatively low numbers, I think we're in probably the top 10 counties across the state as low numbers. There's maybe a few that have less than we do. But having said that, I feel it's very important to really understand where we are here in Chautauqua County and why our numbers are low. It gives us a better idea of how we prepare as we move forward. So I asked on the 12th, I asked on the 20th, and on Monday afternoon's call, I'll ask the same question, is that we could, get the antibody testing here. So it has, been through the governor's office, and I'll continue to support the antibody testing to help out our residents in Chautauqua County.
Testing supplies, we as a health department don't necessarily get them, but our healthcare providers in the county go to their normal sources and are ordering testing supplies. We are hoping that supply chain continues. When you have a virus such as what we're seeing now with this SARS virus strain, when it can be transmitted when you're asymptomatic, it really makes testing that much more important to see if somebody is carrying it before they're symptomatic for the disease. Some of our numbers, you'll see more testing. The opening up the elective surgery guidance that came out from the state health department is requiring that everyone has a COVID-19 test. I believe it's within 1 week of surgery. So that's something that we're going to have to be mindful of, because the hospitals are looking for more testing supplies in order to be able to test everybody for their pre-op.
Okay, thank you.
Yes, good afternoon, folks. I wanted to ask to the fact that we're going to be able to move ahead with elective surgeries here in Chautauqua County. Has there been any further word about opening up some of the other lower risk manufacturing, industry, those sort of things?
We haven't heard anything as far as opening up those other low-risk areas. I know Senator Borrello and Assemblyman Goodell rolled out phase 2 and sent another letter to the governor's office with great detail of what those businesses are and what they would look like. Again, I support that. We're in a position now we need to open Chautauqua County. Again, be mindful, being responsible and safe as well. But we think about construction or manufacturing. Several of our businesses have remained open throughout this, so manufacturing has been going on in Chautauqua County. I was watching this morning that Fieldbrook Farms in Dunkirk is actually still looking for employees. So there's manufacturing going on, and getting other businesses back up to 100% or to let them begin manufacturing, I think, is going to be very important, along with other industries where there's a low prevalence. So I support those efforts, and we hope that the elective surgeries is a step in that right direction.
I wanted to do a quick follow-up, PJ, because I know your background is in education, and the governor today announced that basically he's pulling the plug on the rest of the academic year for schools. I wanted to get your reaction to that, number one, and number two, what kind of impact does it have on businesses reopening, especially if you've got a couple of parents that are in the working world, if you will, and they've got kids at home?
Well, the first part of your question is, the canceling of school and the impact, and it's a big impact. I started off today with a troubling video that a father put out of his son in an event that happened. But, one of the pieces in that video, the father said, my son didn't get the hug he would have gotten maybe from his teacher or the camaraderie they had from their friends. And that's really what, kind of spurred me into, my opening dialogue today about reaching out to people. Schools are a catalyst for communication, for interaction. We're social creatures, not only parents, but we have to realize that, the troubles we see in our homes with moms and dads, and the children are there, and what are they hearing? And we know that if a family is, the money is tight and parents are unemployed and not able to pay bills, those types of things stress a lot of people. But having said that, I know I saw a few of my teachers and friends have reached out and very disappointed, and it's not able to say goodbye. And those kids are a part of the lives of all of our educators in Chautauqua County and throughout the country. The teachers connect with those children daily, and it's a big part of their lives that they're missing out on, as well as the teachers. And it's the interaction and the monitoring of our students. Some of our students in the situations they have at home are being monitored by the districts. But it's really important. And, it's disappointing they weren't able to get back to some sort of normalcy, even if not for a couple of weeks. But you're looking at high school seniors now, whether they will or will not have graduations, those types of things, all those questions are going to pop up, so very discouraging. But the question did come up from the governor, and I was watching the end of the press conference today, and there really was no tie-in, and that being the governor said school openings are going to be very much connected with the opening of business. So I guess there's a big question mark right now. What does that mean? If we've canceled schools, what will that mean for the opening of businesses, and at what time will we see that? Again, I'm discouraged, but I know I feel bad for the kids because those kids need the connection. They need to reach out to their friends and interact, and especially teachers. A lot of those teachers are, in some ways, surrogate parents for many of those kids. And, I could tell myself from the students I've had, there's several that just like to talk or be around or just get that comfort and that attention that they may not be getting. So, again, disappointing. But I am going to work with our superintendents. I have a conference call set up for Monday of some initiatives we can get for a little bit more interaction before the school year wraps up, and really to get out there and tell our students how much we care about them, or my former students, excuse me, but really to make that connection throughout this time and as we roll into the summer months.
And thank you for all the updates. It's much appreciated.
Thank you, Terry. And lastly, Western New York News Now, Matt Hummel.
Hi there. I first, County Executive Wendell, as a former student of yours, I want to thank you for those comments. I'm sure a lot of students in the county are going to appreciate that. So thank you.
Certainly.
And regarding my question for you, County Executive Wendell, I know there's been a lot of events here in the city of Jamestown that have been either canceled or postponed due to the COVID-19. I just wanted to get your thoughts on that.
Well, the thought of closing events is very troubling because we look at, we are a tourism county. We rely on tourism as part of our revenue. But having said that, making sure that we are keeping the safety of our residents in mind too is very, very important. As the governor had said, and the question that it's looming is, how far out in the summer are we looking at? I know as far as a countywide position, I know Chautauqua Institution Board of Directors is meeting today. So that is a large area and a large group where if you listen to the governor's responses, that we do not want to have events that bring large number of visitors to your area from outside of the area. But that's tourism. That's what we use here in Chautauqua County to pay the bills. So these larger festivals that are occurring later in the year, it's a great concern. One of the biggest is just the Chautauqua County Fair. The Fair Committee is meeting, but again, that's up in the air. You have the National Comedy Center. We have some of the best known comics in the world that are scheduled to be here in Chautauqua County and Jamestown. So that's a big question. And how far out, will they allow things to happen? We don't know. I guess the one cloud that's out there is the governor is questioning whether or not to open the New York State Fair at the end of August. So having said that, a lot of these big festivals are worrying because these are fundraisers. These are ways churches, I know whether it's the Yasu Festival, St. James Church, and many others have small or summer festivals that are rather large, but that's a fundraising event for them. So it's really concerning. But at the same time, we do have to keep in mind the safety of our residents and the stopping the spread of this virus. If we get the testing data and we get the information we need, maybe that will be, we could use that to leverage some help from the governor or from the state to open events up. But again, that data is going to be important, and we need to do things prudently but safely.
Okay, and on a separate topic, and this is for Christine Schuyler, I noticed last month you and County Executive Wendell expressed concern over an increase in drug overdoses. Because of that, is that why officials are now pushing to give away the Narcan kits?
Yes, actually. I think there's a direct correlation between an increase in overdoses and knowing that Narcan or naloxone is something that can save someone's life. So the more Narcan we have out there in the hands of those who are either suffering and using drugs or their loved ones who could be with them, the better chance we have of saving people's lives.
All righty, thank you both.
Thank you. All right. If there's no more questions, we'll go ahead and wrap up. I think, ending on what the last question was about is really taking time, whether it's our individuals with, drug addictions or isolation issues, we need to take that time. We need to be good neighbors. We need to reach out and lend a hand. I've said it before. We need to be that person that is going to think of others before self. I can think of several people I know personally that their mission, their belief is helping others, and that's imperative. And we all need to think about that as we move forward, reaching out and doing what we can to make someone's day a little brighter. We don't know what little word we say that could really change somebody's mind or change somebody's attitude for the day in a very positive way. So I'd like to ask everybody to continue our work, continue our vigilance, and we're still moving along. We are going to get through this. We're in it together, and stay safe. Stay home, stay healthy, stay safe, and we will continue once again to be CHQ Strong. Thank you, everybody, for tuning in. Thank you for your input. Have a great weekend.
Thank you.
Thank you.